Every year, about 11 million asthma attacks occur. Approximately 5,000 victims will die. It is the most common childhood chronic illness. During an asthma attack, the muscles around the airways tighten and extra mucus is produced, progressively blocking the airway. The wheezing we often hear is the air trying to work its way through narrowed airways. Common asthma triggers include strong odors, such as perfumes, cooking fumes, and chemicals, exercise or physical exertion, respiratory infections, such as the common cold, inhaled substances like chalk or dust, emotional stress, pollution, or allergens.
The signs and symptoms of asthma include labored, rapid breathing, coughing, wheezing, shortness of breath, anxiety, sweaty skin, cyanosis, history of asthma. Often victims will assume a tripod position, which is an upright, rigid sitting position with the arms locked, supporting the body weight. If you suspect an asthma attack is occurring, assist the patient in locating and using their inhaler. If there's no relief from the inhaler, call 911. Help the victim into a position of comfort, usually sitting up, and keep them calm and reassured. If they become unresponsive, perform the ABCDs.
These episodes can occur with little warning, and it's important to respond quickly. Many asthmatics carry inhaled medications that ease breathing during an attack. Without immediate care, the airway can close, leading to death. This is why calling 911 right away is critical. Early treatment may lessen the severity of the attack or even save a life.
Another emergency associated with shortness of breath is an allergic reaction. Around 50 million Americans suffer from allergies. Common allergens include pollen, mold spores, house dust, pet dander, insect stings, shellfish, dairy products, drugs, nuts, and chocolate. The most severe result of an allergic reaction is anaphylactic shock, which includes swelling in the airway and a sudden drop in blood pressure. It's life-threatening and requires immediate emergency medical care. Common symptoms of an allergic reaction include hives, rashes, itchy skin, swollen face, eyes, throat, or tongue, sneezing, difficulty breathing, coughing, and congestion. These reactions tend to worsen with each subsequent occurrence. The quicker the onset of symptoms, the more serious the reaction. Once we recognize these symptoms, it's important to act quickly, perform the ABCDs, and activate the EMS system. Keep the patient calm and reassured. People with known severe allergies may carry an epinephrine auto-injector similar to this one that we use for training. If needed, help the patient locate and administer the medication. It eases breathing, helps maintain blood pressure, and reverses swelling around the face and lips. To use an auto-injector, carefully remove the safety cap and press the injector firmly against the thigh. Hold it there for 10 seconds. Although it's best to inject bare skin, the instrument is designed to function through clothing if necessary. After the use of this injector, even if the symptoms are relieved, take the victim immediately to the nearest emergency department or call 911 for further care.
I'm here for the Olson audit.
Oh, second door on your left, Mr. Olson. The auditors are waiting.
Thank you.
Now we're going to address the most common adult emergency, heart attack. Every year, over 500,000 lives are lost to this killer, and sadly, many could have been saved with early recognition of symptoms and immediate care. So, what is a heart attack? The coronary arteries keep the heart alive by feeding it with a constant supply of oxygen-rich blood. Over time, fat and cholesterol can be deposited in the walls of the arteries, narrowing the vessels. A heart attack occurs when a blood or fatty clot blocks a narrowed coronary artery. The affected heart muscle quickly begins to die.
There are classic signs and symptoms to look for in a heart attack. The most common of these signs is chest discomfort. You've probably heard it called chest pain, but we should be on the lookout for any chest discomfort. Discomfort is often described as pressure, tightness, squeezing or fullness in the chest. Many times these symptoms radiate into the arms, neck, back, or jaw. And while we're all familiar with many of these symptoms, there are other red flags to look for, such as shortness of breath, pale, cool, sweaty skin, dizziness, fainting, nausea, and unexplained fatigue. So, what should we do if we recognize one or more of these symptoms? Any suggestions? If this happened to someone you know, what would you do?
Drive him to the hospital?
That's a common response, and I'm glad you said that, because it's actually the wrong thing to do. Anyone with these symptoms should be placed in a position of comfort, usually sitting up. If these symptoms last for more than 5 minutes, call 911 without delay. And always keep the victim calm and reassured.
I'm here for the Olson audit.
Oh, second door on your left, Mr. Olson. The auditors are waiting.
Thank you. Are you all right?
Yeah, I'm fine. I just need to get out of here.
You better sit down. Sit down. Does your chest hurt?
Yeah, a little.
How long have you been feeling like this?
I don't know, like 20 minutes.
Is everything okay here?
No. Call 911.
Oh, I'm fine.
You're having chest pains. You can't catch your breath, and it looks like your arm hurts.
So anyway, it seems like I've got it downloaded to my hard drive, but no matter how I try, I can't get that sucker to run. What am I doing wrong?
All you have to do is convert it to an MP3, upload it to your FTP server, and post the URL in your blog.
Translation, post the what in my what?
I'm just gonna take these away.
Oh, Rachel, are you all right?
Though heart attack symptoms and response are widely known, the need to recognize and quickly respond to stroke symptoms is often overlooked. Every year, over 700,000 Americans suffer a first or recurrent stroke that often leads to disability or even death. 15% of strokes are due to bleeding inside the brain. About 85% are associated with a blood or fatty clot that has become lodged in a cerebral vessel. This blocks the flow of oxygenated blood to that portion of the brain. Here, time is of the essence. Early recognition of symptoms and transport to the hospital may give the patient time to receive clot-busting medications that can reduce or eliminate the effects of a stroke.
Let's talk about the symptoms of stroke. These can occur suddenly and in any combination. Weakness or numbness, usually on one side of the body, difficulty walking, facial droop, difficulty speaking or swallowing, confused or decreased alertness, sudden dizziness or severe headache for no apparent reason, or changes in vision. If you're uncertain if someone is experiencing a stroke, err on the side of caution and send a bystander to get help or call 911 yourself if you're alone. Then initiate stroke care. Initial care for a stroke victim isn't complicated. Stroke victims often have difficulty controlling their tongue or managing their own secretions, so you should check the airway and make sure it remains open. If the patient can sit up unassisted, allow them to do so. Otherwise, place the victim in the recovery position on their affected side. Calm and reassure the victim. Continue to monitor for normal breathing and prepare to do CPR if breathing stops.
I'm just gonna take these away.
Oh, Rachel, are you all right?
Should we get some aspirin?
No, I remember these signs. Looks like a stroke. Mary, call 911. Help me get her to the floor.
Assess ABCDs. Protect airway. Place on affected side.
Is she gonna be all right?
We're here for you, Rachel. Just stay calm.
The paramedics. They're on their way.
Activate EMS.
Now we're gonna work on your deltoid.
Okay, cool.
Now you try. Mr. Howell? Mr. Howell?
A seizure is an abnormal electrical discharge in the brain. The symptoms displayed depend on the part of the brain that is affected. It may affect only one part of the body or the entire body. In some cases, the seizure can involve unusual sensations, visual disturbances, or staring spells that look like daydreaming. Up to 5% of the US population may have a seizure during their lifetime. Many seizure conditions are kept in check with medication, but over time, the body may develop a tolerance. If patients mix medications with alcohol or take medications inconsistently, they may experience another seizure. So what causes a seizure? The most common cause is epilepsy. However, many things can lead to a seizure, such as a brain tumor or injury, drug overdose or withdrawal, poisoning, low blood sugar, infection, heat-related emergencies, or any sudden lack of oxygen to the brain.
Seizure can be frightening to see and can last for several minutes. When a seizure is over, the patient may still be at risk. So let's talk about signs. Muscle twitches, rigidity and violent rhythmic contractions, lip smacking, mouth movements, drooling and tongue biting, head turning and purposeless movements, dilated pupils, sweaty, flushed skin, incontinence, and confusion or unresponsiveness. So when we witness a seizure, what can we do? Many times a patient can sense the seizure is coming and warns us. So we place them on the floor and remove any objects or furniture. Protect their head from hitting the ground with some sort of cushion. Ensure that you don't restrict their movement or close their airway by raising the head too high. Activate EMS. Loosen any tight clothing, especially around the neck. Ask spectators to leave. Try to time the length of the seizure. There are some actions associated with seizures that rescuers should not take. Do not put anything in the victim's mouth. Do not restrain the victim. Do not move the victim during the seizure unless they're in a dangerous location. When the seizure is over, the patient is still at risk. After the seizure, the patient may be unresponsive. The key thing to remember here is to maintain an open airway by placing the victim in the recovery position. Continue to monitor for normal breathing and ensure that EMS has been activated.
Now we're gonna work on your deltoid.
Okay, cool.
Now you try. Mr. Howell? Mr. Howell?
Protect the head. Remove nearby objects.
Mrs. Howell!
What's going on?
He's having a seizure. Call 911.
Oh my God, okay.
Activate EMS. Perform ABCDs. Place in recovery position. Another type of seizure common in children is a febrile seizure. These types of seizures are triggered by a rapid rise of body temperature to over 102 degrees Fahrenheit. They are most common in the first few years of life, but can be seen in children up to age 5. If suspected, follow the seizure treatment guidelines. Cool the febrile child by removing all clothing and sponging with lukewarm water. If the child starts shivering, stop the cooling process.